I have more COVID-19 stories for you, but this one may put a smile on your face. There appears to be hope on the horizon for people living with COVID-19. Researchers in the UK say a cheap, widely available drug can help save the lives of patients seriously ill with coronavirus. Officials say the low-dose steroid treatment, dexamethasone, is a major breakthrough in the fight against the deadly virus. But what more do we know about this drug? Let's go onto Zoom now and speak to a pharmacist, Kwame Sapon-Esiedu. He joins us. Thank you very much for your time here on Joy News Prime. First, should we be celebrating already the establishment of this drug as a potential cure for COVID-19? Well, Mr. Esiedu, I guess you have to unmute. I think you have muted your sound there. If you can unmute so we can hear you.
Yeah, hello.
Yes, we can hear you now. Kindly go ahead, sir.
It's a very difficult one for me because the story that ran before you asked me this question, someone I've known from childhood, someone I grew up with, someone I swam with, someone I attended university with, someone I attended primary school with, someone whose elder brother I sat in the same classroom with when I got back to Ghana from England as a kid. So for me, that's the reality of COVID. Harry's death is a wake-up call for all of us. And for anyone who grew up on the campus of KNUST, then UST, at the time I was growing up, between 1979 and 1989. Having said that, and thinking of his soul and wanting his soul to rest in peace, I would say that dexamethasone is not something to be celebrated, not because it is not a breakthrough, but it's what I call an adjunct to the management of COVID. It's not a cure. It is what in health we call a modulator to one of the main killers due to COVID, which is the cytokine storm. And when that happens, your body recognizes your organs, your heart, your lungs, your kidneys as foreigners. And then the army of your body, which is the immune system, starts attacking it. And what dexamethasone does is to break this chance of your body attacking your immune system and stopping the cytokine storm. So yes, it is a brilliant breakthrough. But the most important thing I want to say is that for people in Ghana, if anything, you need to be celebrating those at the forefront of managing this COVID fight, because they've already been treating COVID and managing COVID with an adjunct of dexamethasone called prednisolone, and in some instances methylprednisolone, which may probably be a reason why our death rates, albeit the issues around is our data correct, might be slightly lower than the world average. And so that is how I'd want to situate this conversation.
And would you say the steroid we are using is much better than what the UK is telling us now, dexamethasone?
I wouldn't say it's better or worse. It is actually in the same family. So when you talk of medicines, you're always talking about what we call dose relations. So you probably would give dexamethasone at something like 2 milligrams and give prednisolone at 25 milligrams. But you get the same dose response, which then means that you get the same outcome in the case that you prevent death. But more importantly, the side effects would not be any different irrespective of the dose, because they are drugs in the same family.
Now, for purposes of education, we saw what happened with chloroquine, with vitamin C, when it was announced as part of treatment for COVID-19. How available is this drug on the market? And if someone is listening to us or watching us right now who wants to get this, what will be your advice to that person?
Don't go and get it. This is a prescription-only medication. It's not a medication that needs to be managed with the layman.
Okay.
It needs to be managed with a health professional in direct control of the medication. The biggest issue with COVID is not to get the disease and try and self-medicate, which is what I want to expunge based on this conversation. The biggest issue is about preventing yourself from getting infected. Avoiding the infection requires social distancing. It requires washing your hands. It requires wearing your face mask. It requires using your sanitizers. It requires avoidance of crowds. That is the key issue. What is being put out, which I say already is happening in Ghana, is the fact that should you get infected and should you have comorbidities and should you go into crisis, there is now a bigger understanding of a medicine that can actually decrease your chances significantly of losing your life.
Absolutely, and which is what researchers in the UK are actually telling us. Dr. Kwame Asiedu-Sarpong, thank you very much for your time here on Joy News Prime. We appreciate the education you've given us on dexamethasone, which is being, claimed as a very good cure for COVID-19. Not a cure exactly, but part of the medication for patients who've tested positive for COVID-19. He joined us from the UK, and we are grateful. You're watching Joy News Prime with me, Anas Miniriti.